1 out of 5 women in India suffer from polycystic ovary syndrome. PCOS affects millions of women of reproductive age in India and is the leading cause of infertility. Hi, I'm Sania Mirza, and I take privilege to welcome Dr. Vaishali, a renowned health expert who will offer practical strategies to empower women in managing PCOS complications. Raising awareness about PCOS can greatly benefit women due to the numerous myths and misconceptions surrounding the condition. Doctor, can you enlighten us on how a balanced portion control meal can positively impact a PCOS patient?
Thank you, Sania, for this very interesting question. And it is truly commendable that a worldwide celebrated athlete like you is increasing PCOS awareness, because PCOS truly is a huge public health problem nowadays. And the incidence of PCOS is truly rising. And talking about health and the diet control and the portion, what you mentioned. So for PCOS patient, most of the patient, 80% patients are obese PCOS patient, and it is important. Weight loss is one of the important aspects for managing of PCOS. Portion control is very essential. Even if a patient loses 10% of her weight, it can go a long way in controlling the hormonal imbalance, the insulin resistance, and the sequelae that follow because of it. So when we talk to a patient, suppose she's 70 years old or 70 kgs in weight, then we say try to lose 10% of the weight. 10% is 7 kg. So even 7 kg weight loss is going to go a long way in controlling PCOS. If it's not possible to lose 10% of the weight, then even 5% weight loss, like 3.5 kg for this particular lady, is also going to help her control all these hormonal changes and all these PCOS symptoms. Portion control is very important. Calorie deficit is the key. So for weight loss, tracking what you are eating, keeping a diary is very, very important. A well-balanced diet with little less carbohydrates and more proteins is essential. Nowadays, it's very easy for us, just it's on our fingertips to order food, and people have developed these kind of habits of ordering from outside and eating. So the key here to weight loss would be cooking at home, having home cooked meals, having balanced, good, healthy meals. And when you want to lose weight for PCOS, it's important to set goals. And these goals should be SMART goals, they should be time bound, they should be realizable goals. And you should self-monitor regular intervals to see that yes, you are achieving these goals. Thank you.
Thanks, Doctor. Can you also share how crucial is physical activity in the management of PCOS?
This is a very interesting question, and a lot of ladies ask me this question, that is regular exercise going to help us manage our symptoms of PCOS? So what is really recommended is, lot of scientific evidence is there, and studies have shown that good amount of physical activity has a huge impact on the reproductive health of women. So what does this really mean? It means that the recommended minimum of 150 minutes per week of physical exercise will go a long way to manage PCOS. So this exercise can be any form, walking, running, weight training, strength training, yoga, swimming, whichever form you like, but minimum of 150 minutes per week of moderate exercise is recommended. And with this exercise, what happens is the hormonal imbalance gets corrected. If there's irregular menstrual cycle, the cycle will become normal. For ladies facing infertility issues, it becomes easier and quicker to conceive. And about ladies who face a high blood pressure or diabetes because of PCOS, it can be regulated due to regular exercise. Also, with regular exercise, the testosterone level in the body reduces because the insulin resistance also reduces. And that is the reason why the acne, the facial hair, the hirsutism, all these signs go away. So it's extremely crucial to do regular exercise continuously each and every day at a regular interval. Consistency is the key, and consistent regular exercise is going to help us in management of PCOS.
Thanks, doctor. One more question. What are the important parameters to be regularly monitored in PCOS patients?
PCOS is a condition which affects all the stages in a woman's life, right from adolescence till menopausal age group. So screening for the well-being and continuous investigation, treatment and reassessment for the well-being of the lady is very important. As we know, PCOS causes hormonal imbalance, reproductive problems. It could cause dermatological issues. PCOS also causes psychological issues and cardiometabolic syndrome. Continuous weight loss monitoring, whether the diet is right, whether exercise is being done correctly, self-assessment, self-monitoring is important. When we talk about investigations, blood sugar monitoring, CBC, lipid profile is important. Because of the cardiometabolic phenomenon that occurs in PCOS, there's rise in the cholesterol and rise in the lipid profile of a PCOS lady. Once she is pregnant, there's increased incidence of abortion, increased incidence of gestational diabetes mellitus. So during pregnancy, it is recommended that we do glucose challenge tests to pick up GDM. Extra care has to be taken for PCOS patients who become pregnant because they are associated with higher risk of blood pressure and diabetes. In the menopausal age group, we see there's increased incidence of again diabetes and high blood pressure, cardiovascular events, and even uterine cancers. So regular screening and assessment investigation is very important. And another important aspect is the psychological aspect, right from adolescent girls to an older age group. Because of the hypertestosterone, hirsutism, where there's acne, there's excess hair growth, obesity, because of this, there's psychological impact. So psychological assessment and whenever required, treatment and interventions are important. So a PCOS patient needs to be continuously monitored, assessed and treated. And a healthy lifestyle is going to go a long way in making this patient healthy.
Doctor, the clear message for all women is that meal, movement and monitoring are pivotal in managing PCOS for the benefit of women and society at large. Thank you, Dr. Vaishali, for your valuable insights which can be vital for effective management of PCOS. As an athlete myself, I recognize the importance of lifestyle management for a healthier tomorrow. Together, we can break the stigma, spread awareness, and support each other in this journey towards better health and well-being.